Good afternoon to all of you. Today, my topic for the oral presentation is on deprescribing in an outpatient medical clinic at a tertiary care hospital in Sri Lanka. Before we talk about deprescribing, we'll have a look at this word called polypharmacy. You must have seen in our patients, a lot of them are prescribed with more than 5 medications. We call it polypharmacy. As the medication cost is very high nowadays, it is very expensive for our patients. Especially in older adults, when we prescribe more and more medications, they are likely to develop adverse drug reactions which can end up in hospitalization. These adverse drug reactions account for more morbidity and mortality than their existing illness. So what is deprescribing? It's a process of medication withdrawal supervised by healthcare professionals with the goal of managing polypharmacy and improving outcomes. One component of good prescribing is deprescribing. There are 5 steps of deprescribing. First, we have to identify potentially inappropriate medications in our patients. Then, we have to determine whether we can reduce the dose or whether we can stop that medication. Some medications we can't stop then and there. We have to do little bit of tapering. Not only stopping is enough, we have to monitor the patient and tell the patients if they develop any symptoms following deprescribing to come back to us. And then we have to document the outcome of our deprescribing. Coming back to our study, our general objective was to deprescribe medications that are no longer required. Our specific objectives were to assess overall prevalence of medications deprescribed, to identify the classes of medications deprescribed, to identify comorbidities in which deprescribing has been carried out, and to identify reasons of continuation of deprescribed medication. Our study was a descriptive cross-sectional study carried out among adult patients above 18 years attending our medical clinic at National Hospital Kandy over a period of 1 month in June 2022. We used a random sampling method using our clinic register. Data were collected using interview-based questionnaire. Numerical data were presented with mean and standard deviation, and categorical data were presented in percentages. Data were analyzed using SPSS. Informed written consent was taken from our patients, and the institutional ethical clearance was taken from the hospital. Our sample size was 402. If we talk about demographics, the mean age of our patient population was 62. Majority of them were females, accounting to 59%, and deprescribing was done among 33.58% of our patients. This is a table to demonstrate drug classes in deprescribing. As you can see, majority belongs to antiplatelets, accounting for 37.8%, out of which clopidogrel accounts for 25.2% and aspirin accounts for 12.6%. Other major drug class was analgesics, accounting for 25%. And lot of our patients were on diuretics, vitamins and proton pump inhibitors, which we deprescribed. This table shows disease characteristics in deprescribing. As you can see, a lot of our patients were having hypertension, ischemic heart disease, and diabetes and cerebrovascular disease. You can see the percentages from this table. If we talk about reasons for continuation of medications, there were no clear indication documented in 68.1% of our patients, and some drugs were used longer than recommended in 30.4% of our patients. Our conclusions were the commonest drug class in deprescribing was the antiplatelets. A significant number of patients also been prescribed analgesics without any clear indication. Both drug classes could lead to unwanted adverse effects, including life-threatening bleeding in majority the reason for continuation of the medications were not clearly documented. So this inappropriate use of drugs has become a concern not only in Sri Lanka but around the world, leading to adverse drug effects. Furthermore, in Sri Lanka, we are going through an economic crisis. This quality improvement project will reduce medication burden and save a huge amount of money spent on these medications. There were few limitations in our study. The medication-related adverse effects has not been assessed, and the patient concerns in deprescribing has not been addressed. So our recommendation is we have to carry out regular medical reviews in our patients with a view to undertake stepwise approach to deprescribe medication. Thank you. With that slide, I'm going to conclude my presentation. I would like to thank my supervisor, Dr. Kumudini Jayasinghe, Dr. Tamara Kannangara, and my registrars, Dr. Chandana, Dr. Dimantha, and my co-SR, Dr. Savandika. These are my references. Thank you very much for listening. Thank you.